So I just want to welcome everybody. So let's see, right now we've got 217 people, but there were 1,200 of you registered. So we'll hopefully see and connect with 1,200 people throughout this event. I wanted to welcome everyone to the very first free Disrupt OT Community Summit. You're all helping us make history here with over 1,200 people registered for this event from around the world. Feel free to use the chat to say hello and share where in the world you're from or where in the world you are. And we're going to be closing the chat once our panelists begin to share. I'm Sheila Ivlev, a cisgender South Asian woman in my late 30s. My pronouns are she, her. I have medium brown skin with wavy black hair, and I'm wearing a green and red kurta, and I have a lamp and Ganesh statue behind me. When the idea of Disrupt OT came to me in January, I knew that it was necessary, but I never thought that it would turn into a movement, which it has clearly become. There are many of you to thank for making this possible. The speakers that said yes before knowing what they were getting themselves into, the volunteers that dedicated their time and energy to making this come to life, and they asked for absolutely nothing in return. Mitchell Hawkins spent months building and updating our website, and Leanne Hilbert created every single graphic that drew you to this event. You can learn more about each of our speakers and supporters on the event website, which will be shared in the chat. And also want to acknowledge all of our sponsors that jumped at the chance to support our speakers, allow us to put on this event for free, while also ensuring that the labor of everyone that you're going to see this weekend was fairly compensated. I reached out to over 1,000 organizations, and these are the ones that showed up to support us. So please check out the sponsors on the event website. That's also going to be shared in the chat. And I want to acknowledge everyone that contributed to our mutual aid fund. Almost every single speaker has been accounted for. It hasn't been paid yet, but will be fairly and equally remunerated. I can never say that word, remunerated for their labor, for their knowledge contributions, for their experiences, and for all the work that they've been putting into this event. We're also going to share the link to the mutual aid. If you are able to contribute, please help us reach that goal. And we are going to close the mutual aid fund as soon as we reach that goal. The goal is to get everybody fairly and equally compensated for their labor. And I also want to thank all of you for sharing, supporting, and just showing up. You are all a part of making history this weekend. I know that it hasn't been easy for many of us to be here today. It's been a challenging year and a half for every single person. Many of us lost loved ones we weren't able to say goodbye to. Many of us experienced or are still experiencing natural disasters, the pandemic, apartheid, civil wars, crumbling economies, so many more difficulties, but you still showed up. So these circumstances require a strong community for us to survive and ultimately thrive, which brings us to our topic for our first panel today. We're going to be discussing how to return to community and a communal way of doing and being with our panelists today, Ayla Emery Whittington, Mr. Waguma Hassan, Dr. Laura Yvonne Bulk, and Ms. Anne Senna 4D. There aren't many communities left untouched by colonialism and capitalism, which have pushed many societies from focusing on the good of the whole community to what's best for the individual. Today, we're going to be discussing what community looks like in the context of our panelists, understand why community is necessary, and learn how we can go about building community wherever we are. At this time, we'll be closing the chat function. So please use the Q&A to ask relevant questions, and we'll try our best to get to as many as we can at the end of the panel. We're going to just start off by letting our panelists introduce themselves, introduce their communities, and share the work that they're doing. I'd like to ask, after stating your name, if you can also just give a brief self-description of yourself. So I'll ask Isla to get us started.
Morena e ngā tini maunga e ngā tini arawa o ngā pito te ao tēnā koutou katoa. My name is Isla Emery Whittington, and my pronouns are she, her. I'm an Indigenous cis woman from Aotearoa, New Zealand. I have a traditional marking on my chin, and it's dark green in colour. It's just goes from my bottom lip and covers my chin, goes down. It's my honour, my absolute honour to be here and greet you and all of your sacred spaces and mountains and waters. It's really lovely to be here. Do I carry on, Sheila?
Yes, please do.
Okay.
Yeah, please
Alrighty.
share a little bit more about yourself, your community, cool. and the work you're doing in your community.
Alrighty, thank you. So my mountain is called Kakipaku. My river is called Waipa. My people are Ngā Te Maniapoto, and our home space is called Te Kōpua. So just a little bit, I guess, of background about who I am and a little bit about New Zealand, a place that is also called Aotearoa by some. It was a space that was colonised by the British, although we had a treaty, and that was signed in 1840. The treaty has not been honoured, and unfortunately there's been a lot of confusion about what that means, but there really is no confusion. There is only one legal text, and that is the Māori text. Recently, our health department has begun to acknowledge this, and so that has meant that the really poor health and landlessness and all of that gets to be acknowledged now. It's important to note that we're not dead. We survived. We're still here despite everything that has happened. And in that spirit, there are some things that we want, and we're making that really clear. We want our culture, our heritage to be known and to be shared and taught in schools so that everybody understands our history. We want being Māori in our culture and all of our health spaces so that we can share our healing practices and our sacred work. And we want that everywhere in health, and especially occupational therapy. In terms of my work, so after 2 decades of mostly working in mental health and Māori health spaces as well as mainstream, I'm now a researcher. So with my PhD, I get to take a deep dive into Māori knowledge and Māori understandings of human occupation. So I'm pretty excited about that. Central to a Māori understanding of knowledge, though, is, and I've come to understand it, it's really important to share that we don't believe that our ways of knowing that our truths are necessarily truth and our ways of knowing for other people. We don't even believe that for the next tribal group or nation across the river. We don't. So the idea is that you don't impose what you know on other people. That's considered, quite bad manners. So we don't believe in the model of practicing occupational therapy. We believe that there are many knowledges and many understandings, and they're all important. And that's because knowledge is contextual. Knowledge builds up over generations, and it's experiential, compounded layering knowledge. And that's so important for that space and those people, and that must be respected. So so my work is a little bit different. I'm not coming up with the model of Māori occupational therapy, or the Māori theory of occupation. It is a Māori way. In terms of community, so every month I return to my home space, my community, and it is a space where the white gaze is taken away for a good weekend. We get to kōrero Māori, speak Māori. We learn our prayers, our chants, our dances, our ways of thinking about the world and how to heal. So this is what I get to do, but more importantly, the community I get to bring that to is the Māori occupational therapy community that formed out of necessity, out of just being able to get together and share stories and eat how we eat and talk how we talk, and even introduce ourselves how we introduce ourselves. We do it in a Māori way. All of our Māori being can come to an occupational therapy space. So I'll be talking a little bit about that space. I'm keeping my eye on you, Sheila. I'm thinking that was my 4 minutes.
Wonderful. Thank you so much for sharing that lovely introduction. Laura, can you please tell us about yourself, your community, what you're doing in your community?
I'd be happy to. Hi, Chika. Dankjewel. Thank you for being here together today. I am glad to be here. Laura Yvonne Bulk is my name. And today in the room with me, I have behind me are some photographs of my family members, including my grandfather, who we buried yesterday and whose birthday is today. And so I acknowledge where I come from. I am a Dutch settler on Wasanic territory, on what is now known as Turtle Island by some in North America and British Columbia specifically. I am a cis white woman. I have a braid and dark hair. I'm wearing a blue blazer and colorful shirt. I also have with me, I don't know if you can really see it, an orange blanket, which for me has multiple meanings. It is acknowledging the people on whose land I stand right now, and on whose land I am very privileged to be and belong. And I also identify as a disabled occupational therapist and scholar, and that's an important part of who I am and of the community I'm going to be talking about today. I acknowledge I'm part of many communities in my life and in my doing, being, and becoming and belonging. And the one that I'll specifically be talking about today is the disabled community, and the community that includes as well our co-conspirators or our allies. And I think I've covered everything. Let me know if I haven't. But I am glad to be here with you. And thank you also to my co-panelists. I'm excited to have a conversation with you.
Thank you so much, Laura. I'd like to invite you now, Anne, to share about yourself, your community, and the work that you're doing.
Okay, so hi everyone. I am Anne Senafodier. I am an occupational therapist from Ghana. So I'm currently in a ponytail with my natural hair, and I'm in a white top, and I'm in some earrings made by a friend of mine from Ghana. And so I am working in adult mental health and pediatrics. I am currently the clinical head of occupational therapy in my hospital. And aside of that, I also run an NGO known as Sena Pediatric Therapy. And our main goal basically is to facilitate inclusive education for children with disabilities in Ghana. Most of the time in Ghana, children are segregated instead of, put in mainstream education. And then you would have some parents who also hide them in their rooms because of stigmatization. And so a few colleagues and myself partnered to come up with the NGO to sort of help parents in this situation and then facilitate inclusive education for children with disabilities. And aside of that, I am the current president of the Occupational Therapy Association of Ghana. And as part of our work, we basically advocate for the OT profession, and we also support occupational therapy practitioners and our service users in Ghana. And some of our roles include advocating for things like employment, better salaries, better conditions of service. We also do a lot of empowerment for our patients. So we prefer to empower them so that they can advocate for themselves. In our part of the world where stigmatization exists, people do not think that persons with disabilities or mental health challenges or the vulnerable can be able to live life to the fullest. And so as part of our mandate, we want our therapists out there to empower people so that they can start advocating for themselves. And when that happens, people would begin to see that, oh, these people can actually live normal lives like you and I. And that will start breaking the barriers and eradicating things like stigmatization and discrimination in our country. And aside that too, we do a lot of continuous professional development programs for our therapists. What we do is we find seasoned speakers to come in, educate them on newer trends. Mind you, whatever they're educated on, we make sure it's culturally relevant to our context. Because sometimes not everything westernized can actually work in Ghana. And so we make sure that whatever program that we organize for our therapy practitioners in Ghana, at the end of the day, is going to be culturally relevant and can serve the population in which we work in. I think that's basically it. We also do a lot of advocacy in terms of advocating for persons with disability at the national level. So we speak to policymakers. Usually when they come up with their policies, they don't factor persons with disabilities or people with challenges into the policies. And so what we do as an association is to make them embrace human diversity, embrace the fact that not everyone is going to come out the same. And so when you are coming up with your policies, you need to factor in persons with disabilities, you need to factor in the vulnerable and the marginalized. We also do a lot of research. So since OT started in Ghana in 2016, we are still currently new. And while we would want to embrace the Western culture, not everything works here, as I mentioned. And so we have a research committee that has started doing researches to find things that work best for the community we find ourselves in. And so for today, I'm going to focus on the OT community in Ghana, and that is what I'm going to talk about here.
Thank you, Anne. You're so humble about your long list of leadership roles. Waguma, I'd like to welcome you to tell us about yourself, your community, and the work you're doing in your community.
Yes, thank you so much, Sheila. I'm happy to meet everyone today. My name is Waguma Hassan, an occupational therapist in Uganda. With me here, I'm just seated. Since we were colonized by the British, the dressing code defines itself that the country was colonized by them. In our occupational therapy practice in our country, Still, when you look at the training, we tend to go through these dressing codes, and to act as an example to everyone, you may find that at all times you are required to look smart with a white shirt, a good necktie, and a navy blue blazer. I'm happy to meet everyone today, and I thank God for this mighty opportunity to connect with everyone in this panel titled Returning to Communities. In Uganda, a community occupational therapy is key. However, it is not so much emphasized and not practiced by everyone, because we tend to have a few OTs who advocate to go to communities, since in the arrangement of our country, you find in the training and the process of acquiring jobs and so on and so forth, people are so much centered in cities and in urban areas. And you find us that in communities where people need OT practice and to OT effectiveness, far from the urban areas, and the cities are not so much developed. And therefore, there are a few people who give in their time, their service, their skills to go to those communities in the villages and connect with everyone. Briefly about what I do, I'm a practicing occupational therapist at Medipal International Hospital in Lower Kololo. I work in community outreach programs with several organizations. I'm a mental health researcher. In my free time, I like to advance and work more about that. And therefore, when I'm free, when I have time, I tend to go and research more about depression. It's actually a silent killer, and so far about what the information we have gathered. And in this pandemic, it has affected nearly everyone, is at least somewhere, somehow, has faced episodes. They might be silent, but people have faced them. At least I'm happy that OT is very relevant at all moments. In whatever situation and the world switches to, this profession in its setting, it is meant to cover all domains of concern. We find we have to address the productivity part of it, leisure and self-care. In the pandemic, where people are not able to participate in leisure activities, at least OT has been there to address the other domains of concern. Despite other professions which you can go to, that in any area that can come, they cannot address all the domains. And therefore, I'm so happy to be an occupational therapist, and I'm so grateful for the opportunity to connect with everyone and to work together. In our communities, before which we are going to talk about, I would like to tell you something that personally, I major in orthotics and assistive aids in communities, using the locally fabricated aids. Since we are a developing country, we don't have much money, and most of our clients don't have money. But how best can we help them as OTs? You have to assess the environment. You see how best can you help this person. And then you use the locally available materials to do something that can lead to quality life. You promote occupational participation, full involvement, and later on you are seeing improve the quality of life. You lead to sustainable development because people will be able to engage in productivity work and so much more. Personally, I participate totally in both paid and unpaid community OT programs, aiming at a few things, but they are crucial when you look at them. One is to market occupational therapy. You see, despite the existence of this profession in our country for over 23 years, the profession is still yet not known so much in communities, organizations, government sectors, and even the public, the primary healthcare providers, the doctors, the nurses, the midwives. These are people we work with in communities, in healthcare facilities, but they are literally not aware of what OTs do. And therefore, in participating in such activities, I'm marketing the profession. Our ancestors and our elders who were first before us in this profession, they did a good job to train those who were first before we came. However, it stayed with a gap that some people in the communities, when you talk about occupational therapy, they are actually not aware of what those people do. And therefore, in engagement in such community activities, you find that they will ask you, but you are doing this and it is helping. What does this profession really do? And you find a chance to explain more freely and you interact with very many people in a group. They gather, you talk to them, and the profession is marketed. Therefore, in communities, I think that is key to do it at a free of charge, to market our profession, to make it known. Doctors should understand what we do, and they actually have to respect it because we are playing a very big role in multidisciplinary care for patients. Number two is to promote awareness and healthy promotion. You see the concerns of OT, the domains of OT we address. It is not only in physical, but we go to mental, we go in pediatrics, we go in geriatrics, a lot of sections we are covering. However, if these sections are not known by the people who are supposed to come for the services to us, then we can do nothing. No one can refer a patient to you if they don't know what you do. For 23 years of the professional existence, you'll find that a doctor may fail to refer a client to an occupational therapist and refers to a physiotherapist or a social worker. But ideally, this patient is meant to be for occupational therapy. And as a person, I thought about that as a key important issue. And I therefore call upon every occupational therapist in the country, I know most of them are here listening, that please let us return back to our communities. In the training of OTs, they go for placements, and most of them are placed in their regions. In our country, we have very many different cultures, and each culture perceives differently about the OT explanations. Some can take it as witchcraft, others are taking it as diseases, others are seeing it in a different way. And the way you approach them matters on how you will manage. And therefore, these people are placed in such areas, knowing the languages they can speak, because they have very many languages, over 200. And therefore, you cannot be one person to master all of them, that you cannot associate with each and every culture. Therefore, my fellow colleagues, fellow OTs, let us go back to our communities. We are the people who understand our cultures. We are the people who understand our beliefs, the values and norms. And we are the people who can talk to these people because they know you are a son of them, you are a daughter of them, and therefore you went to school, they will respect your ideas, you will promote health, you will encourage advocacy, you will lead to sustainable community development, and so on and so forth. I thank you so much. I have a publication that is coming soon. I'm summarizing my research, Depression in Uganda. It is almost coming to an end. And in September, end of it, it will be published if all goes well. Thank you so much for attending. And I love you so much.
Thank you so much, Waguma. I think between the four of you, there is a lot to take in. There's a lot to process, but I want to acknowledge how much humility there is and everything that you all shared. Each of you is a community builder and are doing significant work within your communities. So appreciate you sharing. I want to ask this, this is going to vary from person to person again. Why is community necessary? So I'd like to invite you, Anne, to start us off. You're muted, Anne. Let me
Oh, sorry for that. I'll say that community is created when people with common goals and interests come together to achieve a shared vision. And for Ghana, for instance, because OT is relatively new and the issues that are going to emanate or come from the things that we do or our service in general, it is imperative that we come together as a community and choose a leader that would advocate for some of the things that we do. And for instance, we are advocating for things like employment. At first, because OT hasn't been in the system for a long time, those things were not readily available. And so an OT would come out from school and it will be difficult to even get employment because first and foremost, our doctors, as Waguma mentioned, and prescribers and other persons who we work with in the hospitals don't even know about occupational therapy. And so because you don't know about occupational therapy, it is a challenge to even get them to appreciate the profession and say, I'm going to get you on board and employ you so that you can offer services to people. So I believe that, coming together as a community in terms of an association like what we have in Ghana is a way to sort of support the occupational therapy profession in the first place. And then aside of that, we always say that there's an adage, I think everyone knows this adage, united we stand, divided we fall. Usually when you come together to achieve a common goal, you realize that you are able to move much more smoothly than doing it all on your own. And so I believe that, these are some of the reasons why communities are generally important to be in. And another thing too is it gives one a sense of belonging. When you are alone and you're facing issues in your hospital, for instance, doctors not referring patients to you or not having enough resources to work with, and you do not have anyone you can share some of these issues with, it becomes a challenge. It's like you're the only one in the sea and you're drowning alone. But if you have, a community around you where you can speak to or talk to and say that, I'm going through this, how do I overcome it? Maybe there is an OT in the organization that has gone through a similar thing and has done one or two things to overcome that particular challenge. So it can be a way to share your challenges and then how to overcome them in the long run. Yeah.
Thank you, Anne. And I think most of us can sympathize with, even if occupational therapy is well established for some of us, a little over 100 years, we are still fighting for people to understand what we do and make sure that we can provide services. So to think that OT has only been in Ghana for 5 years, I can't imagine that battle.
Yeah.
Laura, I'd like to invite you to share why you believe community is necessary.
Thank you. And thank you, Anne, for sharing. All right, where do we start? The format. So I will build off of some of what you've shared as well. And so I think something that you shared and that I will pick up on as well is this idea of purpose and meaning. And I think in my experience and thinking specifically, I didn't say in my intro about the specific community that I'm going to kind of address a bit more today. So definitely the community of, in the general community of disabled occupational therapists and our co-conspirators or allies. And then one specific community that I'm privileged to have been part of germinating. We call ourselves the AHA Moments, and we are a group of just that, disabled OTs and co-conspirators from across Turtle Island mostly. And this community has kind of some shared meaning and purpose around anti-ableist work and anti-disableist work. And you addressed as well kind of this idea of when you get discouraged in this meaning or this purpose that you feel called toward, for example, and how important having that community space is. So sometimes the purpose in the community isn't to achieve a goal or be productive in one way of framing productivity. Sometimes the purpose in a community is to have that sense of belonging, that space where you can go and just be together. And it can also be a space where you can generate and germinate ideas around how can we create change and co-create change in the world that we think is really important. And I think in a lot of my work with disabled healthcare professionals, the AHA Moments, we are across professions. So not just disabled OTs and allies or co-conspirators, but across professions. And in my research, as well as my practice right now as an OT, is with students who are studying to be health professionals, who also are disabled or identify as a person with a disability. And in this work, I've really found that community is so important, having connections, and so we can learn from one another, and that's been really important in the disabled community for having that perseverance sometimes to get through, or finding ideas and inspiration from one another of like, okay, there's this barrier, how do we navigate in this space together? And this word belonging, you've already brought up, so important. That's my jam. And having that sense of knowing and being known, and that's, I think, part of how Creator made us, was to be in community, that we are created in community, not just as solo entities. And so really so much of it for me comes down to that as well, this idea of we are meant to be in community. And so that's part of the importance. Anyway, so you got me going now. I'll stop here, and I'm really excited to learn from and hear from the other two of you of the ways you frame the importance of community.
Thank you so much, Laura. And I think, everybody has brought up very important and valuable points, but just recognizing that building community with shared purpose and meaning doesn't have to be of people with the same background as you, right? Community can be different groups coming together, working together, and creating a new type of community. So thank you for that, Laura. And Waguma, I invite you to share why community is necessary. You're muted as well.
Thank you so much, Sheila. Why the community is important. In our practice and in our country, the community is important in several ways. However, in the creation of the community where we practice from, at least there is an advanced way that can easily facilitate this. Only that, one challenging part before we go to it, that you may find that we don't have people who are willing to build and establish communities. With the village health teams set into each and every country, we have the parish health coordinators and so on and so forth. For us to establish a community, we consider the persons in that community, we consider the environment and the occupations of that community or that particular area. You find out that in each region of the country, they have different occupations and they value different occupations. As an occupational therapist, to ensure active participation and a full engagement of people in the community into what you want them to do, because you can never establish a community personally as an OT. You need people, you need staff, you need support staff. So for you to establish it, you need to first assess what are the type of people are you going to deal with, because we have different cultures and of different backgrounds. What are the occupations of a given community that you are working with? And what is the environment of that community or that area? And therefore, if you understand the three ideas, the persons you are going to work with, the environment, and the occupations of a given community or a given area, then you can establish a community. How relevant can it be? If they all team up together, you coordinate with them, you are going to achieve a targeted outcome. Because when you team up, you will all know the root problem. And after it, you will prioritize it together. You set goals together with them. And because they are aware that what you are doing is in favor of what they value in their community, you will find that planning, implementation, and evaluation is going to be automatic, and all people are going to be actively participating in it, provided you have considered the concept of environmental difference, occupational performance differences in that region. And therefore, the importance of it is that we are having targeted outcomes achieved in a shorter period of time, because people are considerate that what you are putting in their mind, what you need a community to achieve, is actually on their favor. In the different regions of the country, I can sample for you. In the Western region, for them, they are cattle keepers. As an occupational therapist, you can find a client who was once a cattle keeper, lost his wealth because he sustained the CVA. The kids or the person who were running the farm were not honest enough, and then they misused the funds. If in that community, that person was maybe a chairman, you gather together, you call them, they have village health teams, these people can assist themselves. If you go to them, you say we have funds, so they can equally assist, and with very pleasing heart. When they assist, they all know that this is what we do, we are cattle keepers. You bring in that idea, they work together, everything is achieved automatically. Therefore, in Uganda, building community depends on the region of the country, specific occupations that are carried out in that country with those people in that side, and then their environments. We have different environments and we have different cultures. So to build a community, you need to understand what type of people you are dealing with, and actually people are coordinating if you value their culture. Thank you.
Thank you so much, Waguma. And you jumped a little bit into what I was going to ask next. So I'll pull it back to you, Isla, and just asking from your perspective, why do you feel community is necessary?
Kia ora, gosh, it was really inspiring listening to you guys. My mind is going off in all these different directions. So why is community important and necessary? I guess from my perspective, it's because divide and conquer is a real thing. And we, New Zealand, being Indigenous is unfortunately, sometimes it gets you to the bottom of the societal hierarchy. And that means that every day white supremacy is killing us. It is hurting us, or we are not getting the help that we need quick enough to prevent death and to prevent further injury and harm. So this kind of way of doing things, white supremacy, thrives when we are disconnected. So this is why community is important. This is why connection is important. Connection heals us, but connection also prevents harm. So the community and the connections that we create in those spaces, it prevents further harm from happening. And this has happened when it comes to not only the Māori Occupational Therapy Network, where we can heal and look after each other and share those awful stories that occur, and what's the next installment of institutional racism. It's also about, okay, but what can we do? What can we organise now to do? And I also need to mention that a few years ago, started to reach out the Māori Occupational Therapy Network, and we started to touch base with Australia and a little bit with South Africa and Turtle Island. And it's just amazing how, inspired and thrilled we can be when we learn each other's stories of resistance and thriving. It's also, we can still be a little shocked and traumatized when we hear about things that occur for our Indigenous families elsewhere or anyone anywhere. But, together that we can begin that process of healing together as well, just with the community, with sharing some of those burdens. It is so much easier. I guess the other thing too that's really important about and necessary in terms of community is that we have an accountability that is different when we have community. So I really like what you said, Anne, about how the collective chooses the leader. It's really important that because sometimes we have these employment systems and ways of doing things, or even positions that you nominate to, and sometimes you have people who don't know the community. So if somebody is elevated to a space, you really want them to be someone that's come in amongst the community, amongst the collective people that are known. They have done the work for years, and they are trustworthy, but they're also accountable to others, and the rest of the community can call them out if something's a little bit not quite right. That's not quite what we meant. Perhaps you didn't represent us quite as what we thought you would. You can get called out on that when you come out of your community. So it's both a safe place, but also, the people that say, not sure about that one, we're going to tweak that a little. And, you really need that. Yeah, and I guess the other thing I wanted to share that, my research personally came out of community conversations, critical conversations within the Māori Occupational Therapy Network. And there are some things that we want to know. And most of all, we want to know, so what are the ways that Māori talk about and think about human occupation? One of the really quick upfront things was that the ways that we've been learning about in terms of human occupation were very, very human-centric, obviously. And that is not our Indigenous way of thinking about the world. We are part of many communities, the orca, the birds, the trees, the mountains are our grandparents. All of these amazing, beautiful gifts of nature are our communities. So already a conversation is different when you have your community and you can bounce ideas off each other, and then you develop these ideas over years. And then, somebody then takes it to a university and studies it. It's in my case. So, but it's also a really safe place to keep going back to when the PhD gets hard, as it does.
Thank you, Isla. And, I think you even brought it back to where we started this session in the mountain meditation. Community is not just there to protect, but to heal from current traumas, past traumas, generational traumas. And so community isn't just people, it's what is around you, maybe what has been there for generations before you that still exists, and is unwavering despite everything that is happening. So thank you for that reminder. So this is going to be a tough one. And clearly we don't have very much time and we have so many perspectives to learn from. I want to ask, how do we begin to create community? It's not going to be a full answer. I encourage everybody to go on to the website, learn more about our panelists so that you can follow them and continue to learn from them, because this is just the beginning, right? This isn't everything. So, I'm asking you to do something difficult. So how do we create community? Maybe where do we start? If you can simplify it, and this conversation is to be continued. I'll start with you, Isla, if you don't mind sharing.
No, that's fine. Honored. So how do we create community? I think I'd be really remiss if I didn't say this, Sheila, this, what you've done here. Again, I'm really deeply thankful for what you've started here. The fact that you've made this so accessible and reached out and made such an effort to support us and get us here. And, and sometimes our humility gets in the way where we're just like, oh, no, not me, it couldn't be me. But in actual fact, we forget that actually we've been doing some amazing work with our communities for a long time. And it's so important to help each other out. So I think one of the really important things about creating community is to support and love and thank and express gratitude all the time, because the work is tough, and I think we just and I'm not really talking about celebrityship. It's not put people on pedestals, because the work is messy and gritty and tough, but I do mean having some patience for when we kind of slip up or we didn't quite understand something, and I absolutely remind myself all the time about this, because as Māori we do carry some colonial shame. Are we Māori enough in this space? And I don't know that I've got enough language to start, and to introduce, and all these silly things that occur when you have colonial shame. But it's about recognizing and supporting each other. We all have that. And when we know that we all carry some internalized racism, then we can support and love and have patience, because it is a real thing. If you don't, that is the person that will come and burn the village down. The person with the internalized racism or the internalized pain that is not being transformed. And that is the power of communities, that we can keep transforming that. A little bit like what we did with Māori o Tēnei, we created an institution outside of mainstream. So we don't get any funding from the occupational therapy key stakeholders in New Zealand. We have resisted being named by them, being taken over as well. And we are our own space, our own sovereign space. And we understand that our sovereignty is further expressed and enhanced when we respect other people's sovereignty, as opposed to imposing a way and a method that we think works and is the way you should do it. Actual fact, no, it's not our place to impose our ideas on other spaces. So, so I guess in terms of how do we create community, for me, it's really simple. On a day-to-day basis, where we look after nature, we look after our creature families around us and those gorgeous gifts that we have. That's how we create, because looking after nature does three things, besides the obvious of ensuring we have food and water and shelter and a future. Looking after nature also connects us with our greater purpose, which I believe is to look after our Mother Earth. But looking after nature also can only be done by community. You can't do it alone. We can do our little bits, but you really have to be in a community space. So that's a little bit about how to create community. Is every day in our own way, in our own spaces, we can be caring for nature.
That's lovely. Thank you. And the other piece I want to bring back up that you had shared was starting with yourself as well, right? Self-compassion, self-reflection, and looking beyond yourself as well. So thank you. Anne, would you like to give us some suggestions on how we might be able to create community?
Okay, Sheila. So for me, communities are not just physical spaces or things like an association like what we have. I am beginning to love the online community. And for online communities, I believe that reaching out to people who are similar and telling them about your ideas can be a great way to start creating a community. And if you have an association like mine, I would always say that you need to treat people with respect and dignity. People who want to join your association or people who are in your association, you need to treat them that way. And you also have to be very open-minded, be ready to listen to all the ideas that people want to bring in or want to share in the community. And you need to, recognize and support each other. I think when people realize that you're supported, they would want to join the community that you created. And aside that too, I believe, working well with each other, that's the best thing. And another thing too is it should be accessible, like the events we are having now, and free to all. I mean, this is a great online community platform where people can come, listen to everything we are saying, learn new things. And so, I mean, if things are more accessible and things are more free for people like us all the way from Ghana to be able to access, then I think that is the right way to go to create more, communities, especially in occupational therapy. Yeah. Thank you.
Thank you, Anne. Clearly, we're on the same vibe. I don't need to add anything to that. Thank you. Laura, can you share how we might be able to begin to create community?
I'd love to. I won't add, I will say yes. And because yes, I concur with what you both have very wisely shared. A couple other things that I will bring in. One is story. I think one of the ways we create community is hearing, knowing, living with one another's stories. And Sheila, you brought up a point earlier as well about we don't need to just hear stories of people who have a like experience. It's so important to hear story from one another and to learn from the diversity. And I think that's part of how this community that and many of the communities I'm part of have become a reality is building that familiarity and that acceptance and embracing one another. Some of my work has been around belonging and thinking about and building a model about how belonging develops. And that is part of it. And part of it is also something that stands out to me is this idea of being in interdependent and trusting relationships. And that's one of the petals of this flower of how belonging blossoms. And I think having that interdependence can be really an important part of knowing that I am not completely separate from you. And speaking to thinking about creation care, that was a beautiful example of how, yes, we can do a little bit, but we need one another. And so having that shared occupation as well, if we're using the occupational language, I think is also very important. And another thread that I'll pick up on is this idea of healing and of community being medicine as well. And that connects with this idea of interdependence. And so I think recognizing that, hearing one another's stories and allowing that to bring us to the recognition of our interdependence and our need for this good medicine that is one another. I think that helps us create community. It wasn't a very concrete example or explanation of how it can happen. And that's why we are going to continue these conversations so we can share some really concrete examples. Yeah, I think I'll stop there because I want to hear what you have to say as well.
Thank you, Laura. And I think what you just explained, we embody it here. 5 people from different parts of the world with very different life experiences, doing very different work, yet we are connected and can share the same space and belong in the same space without having worked together or having too many shared life experiences. Waguma, I invite you to add anything you would like to add to how we might be able to create community before we open up questions.
Yes, thank you so much. How are we able to create community? Apart from the online community that has recently just come because of the pandemic, I would like to tell you how we create community in Uganda. For you to be able to create a community, first of all, you need to be an employed person, an employed occupational therapist. Or if you are still a student OT, you need to be in placement, in a community placement. This is how you can be able to create a community. In our settings, we have stipulated days for meeting of different clients with specific or different conditions. For example, mothers with children having cerebral palsy are seen every Monday. If you are a student or you are a practicing occupational therapist, you will be able to see all these mothers on Monday. And therefore, if you arrange to sensitize them, you carry out a community talk. You find them in their communities, you find them in their district, you find them in their village, you make arrangement, they all gather and you meet them. When you go to talk to them, you don't go alone. You go with the staffs, you go with colleagues, you go with different cadres that are involved in the multidisciplinary management and care for these patients. When we talk to them, we find them gathered. And therefore, by a virtue of the fact that when they come for service, we are reminding them that in 2 months' time, on 2nd of the next month or the other month, we are coming to such and such a village to talk to everyone from that particular area. You find them gathered and automatically you find a community created. But how does it begin? Having a setup place or a working place where all people are coming for OT services, whether the clinic is in the community, whether the clinic is at the health facility, whether the OT clinic is at a rehabilitation center or an NGO, because they all have those areas. And therefore, when you meet them, because we stipulate days, on Monday we are seeing CP, on Tuesday we are seeing hemiplegia, on Wednesday we are seeing those that are having hydrocephalus and spina bifida. And therefore you find an association created, a community created, just because you have a stipulated day for review and seeing of these patients. And therefore, when you go to them, because you have to carry out a home visit, you carry out home visits, you know, so and so is staying in this, even when you're collecting the information, the biodata, you know this and this one is from this area. And therefore, you can organize a community. You set it from your center before you go into the communities, before you go where these people reside, because you have to assess the environment and help these people.
think we might have a technical delay. I'm appreciative that we've made it this far, knowing that people have the load shedding. And
therefore, from the center where you're working from, that's where you begin to create it by the way you interact with them and by the way you sensitize them.
Might be a little technical issues, and we'll have Waguma hop on. I will ask Kalima and Thelma we can turn the chat on. And meanwhile, I do want to acknowledge this must be hard. There's so much information, and welcome back, Waguma. There's so much information and you're not able to use the chat, and that is intentional. Just being present, just listening, being in community without having to speak, just being able to take it in. So thank you for your patience. I will, before we end, Waguma, and move to QA, is there any sentence you want to say to wrap up? I'm sorry about the technical difficulties. I'm sure you didn't want to end on that note before we move on to the Q&A.
Thank you so much. But I just request that let us go to Q&A. You never know. A question may come and it addresses that. Okay, thank you for your flexibility. So one of the questions is, what structures are in place to allow you to participate in your community or your particular healthcare settings actively? Given that the community or healthcare team has a basic understanding of OT roles, I might ask Anne to answer this because this, with OT being so new in Ghana. So Anne, what structures are in place to allow you to participate in your community or healthcare setting actively?
Okay, so in Ghana, some of the structures in place, we have what we call the community psychiatric unit. Well, so I work in mental health, so I'm going to speak from my point of view. And this is a community that was created to have nurses, doctors, and recently OTs to move into the community to see persons who have mental health challenges. And so in our communities, we have the system known as the Community Psychiatric Unit that is directly under the Mental Health Authority. And they usually receive some funds, although not the best, but receive some funds to facilitate movement of nurses, OTs, and some prescribers or doctors to move into the communities. I hope I've answered your question. Okay, let me add that there is something known as the National Health Insurance Scheme in Ghana that is supposed to cover most services. This scheme covers, persons with physical challenges, but doesn't cover persons with mental health challenges in Ghana. So that is not really an effective system for my point of view. But what we have in the mental health system is the community psychiatric unit that goes into the community to address persons who have mental health challenges and how they're living in the community.
Thank you, Anne. This question is for Laura. You mentioned there being a disabled healthcare provider community. As a disabled OT, how do I and others like me join this community? Is there an online group space?
Yeah, thank you for the question. Yes, there are a few, and I'm sure there are some that I do not know about. So I was just trying to write in the chat, there's a Facebook group called Disability, or I'm trying to remember how to spell it. And I'm just pulling up some text that I can also put in the chat around the Access Health Activists, the AHA Moments group. And I'm just trying to pull that up right now, and I'll put the email in the chat, and I'll also post on Twitter for those of you who might be in that space about how you can join the groups and further network. And for those of you out there who know about some other groups that I don't know about, please post in the chat or on Twitter, and we can make those connections and continue building that community.
There is one in the chat. It's a new group on Twitter that just started, and at AbleOT UK is a Twitter handle. So it's there in the chat, and they just launched. So you don't have to be in the UK to join that. I'm going to toss this one to you, Isla. This is hard to do in a minute or two. The question is about communities with very strong cultural and religious beliefs that affect the receivability and compliance of the community members in cases like dysfunction and dependence attributed to cultural and spiritual factors. So are there any specific OT approaches or models that can address those things?
Oh, thank you, Sheila. Yeah, it's an interesting one because in my own practice, I do this underground practice where there are the things I'm allowed to say and document, and then there's the other things that I do. So if I'm working with Māori families that do have a strong belief in spiritual reasons for something occurring, then that's what I work with. And part of the reason is because I really don't know what it is. I don't know what is the cause. I can assume it's biology and biochemistry and all that, but in actual fact, I don't really know. I'm not the expert. And with this family, sometimes people experience things that goes in family trees. So I do the best I can when it comes to as far as I can go with psychiatric understandings, and then I also we have it depending on where I am. Like if I'm working in Māori health services, then it's quite easy. We understand that we must have all worldviews and all explanatory models part of the process until we're really sure. And sometimes it becomes, you figure it out together with the family. So it's not really an occupational therapy model other than, well, maybe it is. It's that in terms of the assessment phase, we take every explanation in. It's not just a biomedical explanation about things. So and so in terms of my own practice, I will do things like if I feel that the family think that this is their spiritual reasons behind something, I will do my own spiritual practices ahead of that meeting each time with that family, just in case, because you don't really know for sure. Yeah, just keep that open.
Thank you so much, Isla. And I think that's very valuable in recognizing that a model might just be one way to do things, and you have to think about the whole world of possibilities, the whole world of people and how they live. So I want to thank our panelists so much for sharing your time, your experience. Please do, if you want to continue learning from them, check them out on the website.